No, doctor.
Sorry, I didn't listen. What?
No, doctor.
Okay. So, Mr. Malik, have you taken any treatment for your this speech? You're telling this slurred.
No, doctor, I didn't feel anything because I know what I'm talking about. So maybe my wife said that I'm feeling some funny.
Mm-hmm. Is there any pain and prick sensation on your face you feel?
No, doctor.
How is about your eating habits? You swallow properly, Mr. Malik?
Yes, doctor. Yes, doctor.
Okay, Mr. And do you have any cough?
No, doctor.
Mm-hmm. Okay, Mr. Malik. So, Mr. Malik, are you taking any medicine
Doctor, for what?
for any medicine regularly you are using?
Yes, doctor. I'm taking multiple medicines, doctor. I'm having high blood pressure, cholesterol. I'm taking this amlodipine, hydrochlorothiazide, and atorvastatin. Occasionally, I'm getting this headache also. So I'm taking this tablet, Brufen.
Okay. Okay. Um, which long-standing medical illness you have, please? Can you repeat?
Doctor, high blood pressure and high cholesterol.
Okay. And any high blood sugar you have?
No, doctor.
Okay. So, Mr. Malik, you told me, please tell me about the medicine hydrochlorothiazide, yeah, you are using and other medicine you do. Are you taking it regularly?
Yes, doctor.
Mm-hmm. Please tell me another medicine. Which medicine you are taking?
I'm taking, doctor, occasionally Brufen tablet.
Okay, Brufen and hydrochlorothiazide.
Yeah, doctor.
Okay, Mr. So, Mr. Malik, uh, do you have in your family has same condition like you have?
No, doctor. But my father had a stroke actually when he was 70.
Okay. Mhm. And do you have any allergy from any medicine?
No, doctor.
Okay, Mr. Malik. Mr. Malik, what do you do for living?
Doctor, I'm a retired teacher.
Mm-hmm. With whom you are living in home?
Doctor, I'm living with my wife.
Okay, is everything fine in your home?
Yes, doctor.
Okay, any stress you have in your life?
No, doctor.
Okay, Mr. Malik. Do you smoke, Mr. Malik?
Yes, doctor.
How much cigarette you are taking?
Doctor, five cigarette daily.
Five cigarette daily. Okay. Okay, Mr. Malik. We will talk about this. Okay, Mr. Malik. Actually, smoking is very hazardous for your health. Have you ever thought of quitting the smoke?
Doctor, not really.
Okay, at the end of session, I will give you a leaflet, okay, in which everything will be mentioned regarding the side effects of smoking. And whenever you decide to quit the smoking, we will take a separate session for you.
Okay, doctor.
All right, Mr. Malik. So, Mr. Malik, please tell me, do you smoke or do you take alcohol?
Yes, doctor.
How much units you are taking?
Doctor, I'm taking weekly 3 to 5 units, doctor.
3 to 5 units. All right. Mr. Malik, please tell me about the diet habits. Which kind of food you are taking?
Doctor, I'm taking mostly home food.
That's good. Okay, Mr. Malik. And do you take exercise?
Yes, doctor.
Good. And how you check your weight?
Yes, doctor.
Good, Mr. Malik. Um, how much is your weight? Can you tell me your BMI?
Doctor, doctor, my BMI is 27.
27. All right. So, Mr. Malik, please tell me about your. Uh, do
Yes,
you
doctor.
feel low most of the time, Mr. Malik?
No, doctor.
Okay, good. So, Mr. Malik, I will repeat. What do you think? What may be the reason of your this condition?
Doctor, I'm thinking that maybe I'm not thinking anything, doctor. I think I'm fine, but my wife think that I'm not fine. Maybe I'm getting older. That's why that's the thing she's thinking about.
Mm-hmm. Any worries you know mind, Mr. Malik?
Doctor, she don't want to see me on the bed.
Okay. And what can I help you regarding this consultation, Mr. Malik?
Can you advise me something that I can tell my wife that everything is all right?
All right, we will talk about this, Mr. Malik. And how this affect your daily life, Mr. Malik, as you heard that your voice is slurred.
Doctor, there's no impact except my wife. She's impacted, but I'm fine, doctor.
All right, Mr. Malik. So, Mr. Malik, let me repeat. You have this voice slur since 2 weeks when your wife told you, and uh, you already have high blood pressures and high blood cholesterol levels. And you are
Mm-hmm.
taking medicines, hydrochlorothiazides, and
Mm-hmm.
occasionally ibuprofen.
Yes, doctor.
Okay, and you think that I'm okay, I'm normal with this condition. Anything you
Yes,
want to
doctor.
add?
No, doctor. That's it, doctor.
Okay, Mr. Malik. So, Mr. Malik, can I examine you?
Sure, doctor. Go ahead.
Okay, Mr. Malik, I will check your pulse, blood pressures, oxygen saturation, temperature. Then I will check your pace for any pain. And then I will
Mm.
touch your scalp. Okay, and I will check your voice. Sorry, I will check your. I will say you open your mouth. Then I will check your by light. I will check inside your mouth. Then I will say you tongue out and tongue inside. Okay.
Mm.
Uh, I will examine it. Then I will check the also check the your neck. Okay.
Okay. That's it, doctor.
Mhm.
Okay.
Yes.
Okay, blood
Same.
pressure 158 by 90. The other examination normal. Patient speech sounds near normal. Okay. During consultation, patient was having slight residual subtle slurring on difficult and consonants, but patient is able to intelligible and clean enough shows face. A very subtle fluttering of right nasolabial fold. Um, and normal facial sensation, followed by tongue protrudes midline. Okay, slight clumsiness, rapid side to side movement. Okay, and eye movements normal, motor tone normal, everything is normal.
Okay. All right, Mr. Malik. Mr. Malik, from taking history and examinations, I will also like to do some tests for you that include CBC, CRP,
Okay,
and
doctor.
ECG and EEG. Okay.
EEG, doctor, you do
Yes.
here.
No, no. Sorry,
Time up.
ECG and yeah. Okay. Mr. Malik, from taking history and examination, I think you have a condition which is called transient ischemic attacks.
Okay, doctor. Then what to do?
Yes. Have you idea about this?
No, doctor.
Okay, it is a condition in which the nervous system of your brain is not informing, not signaling problem. Not, the electricity system of your brain is disturbed. Okay, for the time being.
Mm-hmm. Mm-hmm.
Okay, because of it, you have got these conditions. So, Mr. Malik, I would like to refer you to the neurology. Okay, and when
When
you
I
have
to
to
go,
see,
doctor?
yes, right now I want to refer you to the neurology. Okay.
Okay, so doctor, I can go home and then go.
No, it will be better if you check the neurologist's opinion and neurology checkup as soon as possible. Okay.
Mm-hmm.
Yes, Mr. Malik. And
Okay, time
after
up,
you check,
Doctor Ruhula. Time up. First of all, good thing you did that you diagnose correctly that possible TIA with test arthria and transient facial or hand symptoms are there. Okay, patient need urgent stroke pathway assessment. Okay, here you cannot give the patient coagulation, anticoagulation, and you can send home. So first of all, we have to recognize urgency and explain it. Okay, you have to explain that Mr. Malik, that episodes of slurred speech along with occasional right-sided facial change and hand clumsiness. Okay, suggest that your brain may not be getting enough blood briefly in certain areas. You're getting me, Mr. Malik. Okay. And after that,
Yes.
again, you can continue that we call this event like the TIA. Do you have any idea about what is TIA? You have to explain the TIA. Although your symptoms come and go, they are a warning signs. That could be at a higher risk of more serious stroke. We need to treat it as a urgent. Are you getting me, Mr. Malik? Okay, then emphasize this is not something to manage only by watchful waiting under primary care. So you need to we are I'm referring you to a higher center for the treatment right now urgently. Okay, so now here at a GP level, whatever you can do it. Depending on the local protocol again, adopt wording of your region. But in the exam, doctor, you can show. You know that principles how what are the principle to follow and what are the things to go. For example, the patient having ongoing symptoms or within last 24 hours and especially within 4.5 hours with persistent deficit. Okay, so call emergency services, arrange immediate hospital assessment via stroke or TIA pathway. Again, you have to follow the local guidelines in Pakistan. Okay, for possible acute stroke treatment, like say thrombolysis and thrombectomy if indicated. So you have to explain what they will be doing with you. And a patient having symptoms which is fully resolved, okay, but have occurred within last 7 days. Here, what you're going to do it, you're going to arrange urgent same day or rapid access TIA clinic as per the local guideline assessment as per the local guidelines. Okay. But in this station, whatever you have done now, it was you can assume, doctor, that he had a several recent events, okay, including some lasted within 24 to 48 hours. So you should treat as a urgent same day referral. Okay. But now
Mm.
if medication, let's talk about the medication. If there is no contraindication and there is no bleeding suspected, give aspirin 300 mg straight. Okay. Do not
Totally.
start anticoagulation without specialist input until unless there is a clear diagnosis and plan from the stroke team. Okay. Here, that
Uh,
agenda, many of
okay.
our doctors, they start anticoagulation because they're thinking they are going to start anticoagulation. That is not suitable. Again, based on the duration. Here, maximum you can give aspirin 300 mg straight.
Dr. Rahman, sorry, one question I want to ask. It is suspected now that this is the hemorrhagic stroke because
No,
already
it's
the
not.
patient has high blood
It is
pressures. Yeah.
high blood pressure, but under control. No, he's taking medication regular basis. It's not that suspected. He don't have that much symptoms, okay? But his symptoms will last happened last 24 to 48 hours because still he's falling under the category for urgent referral.
Okay.
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 Yes. But again, I'm
So
telling
at
you, if
that
there is no
condition, we can we at that condition can we give aspirin? Yeah, 300
yes,
milligram.
for example, let me talk about a patient's examination. Here, what you're going to examine the patient, okay? At the time of examination, you have to see while talking also you see that there is no episode like the slurring of speech and his speech sounds normal. So you will be fine. But for example, during the consultation, if you found that he's having residual subtle slurring of and difficulty for the consonants, okay, so you might think about some sort of abnormalities ongoing. Okay. Now, what a cranial nerve going to check it? Okay. For the face, for the tongue, palate, and eye movements. Okay. So you have to go with the cranial nerve examination. Okay. Plus, you have to check the motor and sensory for the limbs. Either one limb upper, one lower. Okay. No, not to check. No, no need to check both sided. Okay. And
Okay.
yes. So here that agenda to know how fastly you are reacting. If like say you are saying that I'm going to do some blood investigation, this thing, that thing, that thing, this is a we call it pitfall. It means like say you are not attending emergency case, you are dealing this patient as a regular case. Okay, you should not verbalize that I'm going to do it. I'm saying going to send it right now. Don't delay the patient.
Okay, doctor.
Okay, so this is from my side. Dr. Iram Qureshi is there.
Thank you, Doctor.
Thank you, doctor. Dr. Iram Qureshi.
Yes, sir.
Dr. Iram, your patient is 62 years old Ahmad, Mr. Ahmad Rahman. He come to discuss his problem with you, take proper history, examination, and manage the patient. Okay?
Hello. Start.
Yeah, start. Yes,
Hello,
Dr.
Mr. Rahman.
Just give me 1 minute. Dr. Horijanath, I will be giving you a chance also. Dr. Sadaf also there, you also there. So you will be getting the chance for today. Okay, don't worry. Okay, Dr. Start.
Hello, Mr. Ahmed. I am Dr. Ram. How can I help you?
Doctor, my bowels have been changed over the last couple of months and I'm worried about it.
Tell me more about that.
Uh, Doctor, I'm suffering from this problem almost now 3 months. Okay, and initially I used to go to toilet once a day with formed stools. But doctor, nowadays I have to go 3 to 4 times, and stools are looser than before. And sometimes I feel urgent and I need to go rush to the toilet. It's not possible for me everywhere I will be getting the toilet, doctor.
Okay. It is first time, or you have before that this problem?
Doctor, this is the first time.
Okay. It is started sudden or gradual?
Doctor, I don't know. I just noticed that since 3 months I'm getting this problem.
Okay. As you said that you pass a stool, it is a semi-solid or watery?
Doctor, it's kind of looser actually. I won't say that it's like a soft type.
Okay. Did it contain mucus?
Occasionally some slimy mucus is there, doctor.
Okay. And did you feel any blood in that?
Sometimes I'm noticing that some red blood streaks on that stool, maybe when I'm wiping with the paper.
Okay. Did you feel comfortable after passing a stool?
Doctor, I feel that it's not comfortable. I feel discomfort in my lower tummy.
Okay. Did you have any pain?
Yes, doctor, I have mild pain actually on that side, but I won't say that pain, doctor, it's discomfort.
Okay. Do you have any blottiness,
Sometime, doctor.
any nausea,
No, doctor.
any vomiting,
No, doctor.
fever?
No, doctor.
Do you feel that you are tired all the time?
Yes, doctor. Nowadays, I'm feeling that I'm not that like before.
Do you have any rash in body?
No, doctor.
Do you have any difficulty flushing of a stool?
No, doctor.
Any joint pain?
No, doctor.
Okay. Do you bother by weather?
No, doctor.
Do you have any long standing illness?
Yes,
Blood
doctor.
pressure?
Yes, doctor.
How long?
It's been 20 years, doctor.
And are you taking medication regularly?
Doctor, I'm taking amlodipine tablet 5 mg.
Okay. Did you take any blood thinner?
No, doctor.
Okay. Any sugar?
No, doctor.
Okay. Does the has similar problem in running in your family?
You mean to say my family? Doctor,
Yes.
my father had some sort of cancer in his bowel, but I'm not sure about it, doctor.
Okay. Mr. Ahmed, did you loss of weight?
Yes, of course, doctor. Last 3 to 4 months, I lost 5 kilo.
Okay. And Mr. Ahmed, I would like to ask few personal questions. It's okay with you?
Sure, doctor.
Do you smoke?
I used to smoke, but nowadays I'm not smoking.
Okay. And did you drink alcohol?
Yes, doctor, I used to, but not now.
And did any reason to quit smoking and alcohol?
Doctor, I can't afford now.
Okay. Okay, Mr. Ahmed, what do you do for living?
Doctor, I'm postmaster.
Sorry?
I'm postmaster, working in post office,
Okay.
doctor.
Okay. And how's the thing at work?
Everything is doctor. Good.
Okay. Who live with you?
Me and my wife, doctor.
Okay. And which type of diet are you taking?
Doctor, I have, loose denture, so I'm taking mostly soft diet.
Okay. And do you have any idea what is running on?
Doctor, I thought maybe just age or something I was eating maybe because of that one. I'm having this problem.
Okay. And do you have any specific worries?
Just doctor, I'm just fearing that I should not be a bowel cancer.
Okay. And what do you expect for me today consultation?
Doctor, just can you test me, do some test and can you tell me whether I'm having some uh, cancer in my body?
Okay. And does this affect your life?
Yes, a lot, doctor, because I'm getting hard to get toilet when I'm outside. So I had to go 3 to 4 times a day.
Okay. Mr. Ahmed, let's sum up. You have a loose stool since 6 months on and off. Right now, it is increases and lower tummy discomfort, and you are worried more for the bowel cancer. Anything else you want to add in?
No, doctor, that's it, doctor.
Okay, Mr. Ahmed, I would like to examine you. It's okay with you?
Sure, doctor.
Pulse, BP, temperature, BMI, and I would call the Chevron. It would be possible for you to off the shed to
Doc-
examine. I examine you.
Doctor, you want me
Okay,
to remove
thank
whole
you.
shirt or you want to remove the half?
I would like to remove whole sheds.
Okay, doctor.
Okay, and first of all, I feel the any pulmonary edema, any flapping tremor. Look for the abdomen, any bruise, scar,
Hmm.
anything else, and first of all, simple palpation, then deep. And I would like to palpate the liver, spleen, and also the kidneys, and
Hmm.
listen the gut sound, and
Hmm.
also the liver of upper border, percuss the upper border, and listen the gut sound. And I would like to abdomen your per rectal examination with the complete privacy.
Okay, doctor. Examination shows vitals stable. Patient mild, pale, inspection abdomen not distended, palpation mild, diffuse, lower abdominal tenderness, more on the left side, no gardening, no palpable masses. Okay, percussion normal, auscultation normal. Rectal examination shows no obvious external hemorrhoids or fissure. DRE shows normal anatone, no hard mass felt in the rectum, small amount of stool in the rectum with a trace of blood on glove.
Okay. Mr. Ahmed, from your history and examination, it seems to me you have diverticulitis. Are you
Okay,
heard about it?
no doctor.
And uh, and Mr. Because it is a twisting of the gut to inflame the gut sound, and you feel a pain and also passing a blood in stool. I would like to refer you to the specialist, GI specialist. Meanwhile,
Mhm.
do some lab tests. It's okay with you?
Doctor, why GI specialist? Doctor, what is this GI?
It could be something serious because you have already family history of bowel cancer and you loss of
Time
5
up.
kg weight.
Time up, doctor. So, Dr. Aram, why you say diverticulitis, doctor? Any suspect thing?
It could be a cancer a mass, right-sided mass की वजह से है.
Mhm. Okay, doctor, in this way, you have to say that I have noticed that your bowels have become more looser and more frequent over the past few months, and you had some blood in your stool and lost some weight. Mr. Malik. In some of if in some of someone of your age, these features are concerning that we have to think about some possibility of something need to rule out further. So at this point, I'm unable to tell you what's going on with you, but I'm suspecting that there's something. For my suspicion, I need to refer you to the specialist. Okay, because you have a change in bowel that which is suspicious for me. Okay, you should not use a colorectal cancer or whatever so on, but this is a colorectal cancer case. Okay, so I can't say for the certain what's causing this and without proper test. Okay, but I'm concerning enough that I want to arrange an urgent assessment with the hospital to look for the cause. Are you getting me, Mr. Malik? Okay, now here urgent referral needed for 2 weeks. Wait. Okay, and he should be seen by the specialist 2 weeks. And what they will do, they will be passing the camera from down below. Okay, to see your intestine from down below, and they will be taking. They might take some samples also. Okay, and you have to say that possibly the CT scan. For CT scan, doctor, again, it is as per local protocol you have to talk about, but you have to emphasize that. Diagnosis is critical and greatly affected the treatment options and outcome. So we are not at the point, I'm not going to offer you anything, okay? But you might ask for some blood investigations like this, if blood count to rule out about anemia and ferritin level, urea electrolyte, LFT, CRP, CRP, and ESR. Um, symptoms
Also,
management. Yeah, sorry, doctor.
सर फिट टेस्ट कराना है सर.
No, doctor, here, at this stage, the doctor relying on the fit to decide whether to refer or red flag for age already meeting the criteria for urgent referral. So if you're doing test, it will not be appropriate. So you have to avoid.
Okay, sir.
Okay. So, symptomatic management while waiting for the referral, waiting for that attending for by the consultant, offer a reassurance that you will remain available during the wait. Okay, you can call me anytime. Okay, and simple measures for the diarrhea and discomfort. Avoid constipating or very fatty food that worsen your symptoms. Encourage adequate fluid intake. Be cautious with anti-diarrheal like loperamide if you are giving or something, if patient having constipation for anti-diarrheal for having loose motion. So if you are giving loperamide, it will give him patient severe constipation. Okay, so you should avoid. Okay, treat anemia if patient having anemia, but in this way you should not give any iron medication, but Some protocol says if iron deficiency anemia is present, consider oral iron supplement, but again, do not delay the referral while starting it. Okay. So now there is one more school of thought is there, which says yeah, that you should not treat the patient with iron for the iron deficiency anemia. You should refer the patient because patient is elderly. So there are two schools of thought are there. So as per MRCGP, they say that you have to refer. Okay, you should not wait. But you can give,
Thank
if
you.
like say waiting time is referral time is more than 2 weeks or 2 weeks are there, you can give iron deficiency treatment if patient having what you call it, hemoglobin is very low. But again here GI upset will be more common. Already patient having loose motion, if he is getting, he might be getting abdominal discomfort and other things. So you have to wait, you have to do the weightage while treating the patient. Okay. Okay, so Dr. Sadaf. Okay, Dr. Sadaf is not a Dr. Hurajanat. You can come and you can perform the case. Okay. So after that, we will be taking Dr. Sadka. Okay, Doctor, your case. I need to get something for you. Doctor, I'll be checking because this is a proxy case for you. So proxy case might contain some sort of picture. Okay.
Okay.
Give me 1 minute, doctor. I have to fetch that now. Okay, mother of 4 years old, Master Ali, come to discuss her child problem with you. Take proper history and uh, manage. Doctor, that picture might vary from that one, but still it will be telling you.
डॉक्टर बच्चे का नाम क्या बोला?
Ali, Ali.
अली. Okay.
Okay, doctor. He's a 4 year, okay?
Okay.
Give me 1 second, doctor. I have to take up something for you. Okay, doctor, start.
What is the name of the mother? I forget.
Okay, no, doctor, agenda here for the mother name for everyone, doctor. There is
Hmm.
agenda to know about mother's name. Okay, here, if like say you're asking about mother name, there is no agenda. Here to introduce for everyone, I'm just going to repeat for everyone, okay, before starting. Hi, good evening. I'm Dr. Imran. May I know your name? Yes, doctor, I am Mrs. Shahnaz. Mrs. Shahnaz, how may I help you today? Doctor, I'm worried about my child Ali. Okay, may I know more about it, doctor? He's 4 years old and he's having so and so problem. So here, like this, you have to start. Okay, so it will be more less time consuming and more appropriate and more focused.
Okay. Okay.
Okay, so doctor, start.
Hello. Good evening. I'm Dr. Who. May I know your name and age, please?
Doctor, Mrs. Shahnaz, 46 years old.
Okay. So, Miss Sahnaz, how can I help you today?
Doctor, I'm worried about my child Ali. Uh, his eyes doesn't seem like perfect in the picture. I'm worried about his eyesight.
Okay, Mrs. Shahnaz, I can see you are very worried. I will try my best to help you, Mrs. Shahnaz. May I know, is Ali is with you today here?
No, doctor, he's in the school, so I came to see you. Yes, just started school, doctor.
Okay, okay. So, Mrs. Shahnaz, could you tell me more about it? What is the happening with Miss Ali's eyes?
Doctor, can I show you picture of my child?
Yes, sure.
Then it will be easy for you to understand the scenario, doctor.
Okay.
Okay, doctor, share in the group, shared in the group. Please check.
Yes, I'm checking. Okay, Mr. Shahnas. I have seen the picture. Is it okay if I ask you a few more questions to know more details?
Sure, doctor.
Okay, so for how long you have noticed this problem in Ali's eyes?
Doctor, it's been 6 to 9 months now. I've noticed. Initially, I was seeing some in some photos, but now it's more obvious. And he's trying to looking at things up close, like say book
Mm-hmm.
and tablet. I feel that he's having something different, doctor, in his eyes.
Yes, I can understand. Okay, so it's been 6 to 9 months. Okay, so before that, his eyes was okay.
Yeah, doctor, I haven't noticed, but now it is getting, I feel that it is getting worse, doctor.
Okay, and does he ever complain that he has any difficulty of vision, any blurring of vision?
No, doctor, he doesn't complain of this thing, but because he is very small, he don't understand. But I have noticed, doctor, something that he go more closer to the TV, and when
Mm-hmm.
he's looking at the book or tablet, also he's getting little bit more closer.
Okay. And you have told me that he started the school, and what about his performance in the school?
Doctor, just started last week. Uh, when I saw that there is a group photo in the child, initially I was not thinking that he's having some problem. But when
Mm-hmm.
I saw the group photo of the other children, so his eyes look different to me actually, doctor.
Okay. And does the teacher complain anything that he is about his writing or his studying?
And doctor, he just started school, so nowadays activities are going on, so that's not much attention by the teacher. But
Mm.
I've seen this group photo picture, so I've sure shared with you, doctor. So he
Okay.
looked like this, doctor.
Okay, Mrs. Shahnaz, I can see you're very worried. So, Mrs. Shahnaz, tell me, how about his when he was born? How about the delivery? It was okay?
Normal delivery, doctor.
Okay, and is he up to date with his immunization, vaccination?
Yes, doc. Yes, doctor.
Okay, and how about his apart from these eyes? How about his other developmental?
He's fine, doing well, doctor. He's a play. He's always playing around, and he's active boy and quite, interactive actually.
Okay, and how about his diet?
He's eating well, doctor.
Okay, and is he is your only son?
Yes, doctor. He's only son.
Okay, Mr. Shahnas, anyone in your family, in your husband's side or your side, has similar condition?
Doctor, I'm wearing my glasses since childhood, but his
Mm-hmm.
one uncle having lazy eye that needs some sort of patching when he was a child. As a child, I don't know.
Mm-hmm. Okay, like your husband. Okay. Okay, and
Not
you
uncle.
are
His uncle. His uncle, doctor.
his uncle. Okay, and you are using glasses as well. Okay.
Yes, doctor.
Okay, so Mr. Shahnas, tell me, do you notice any discharge from his eyes? Any like watery discharge?
No, doctor.
Any redness?
No, doctor.
Does he ever complain of any headache?
No, doctor.
Okay, so I can see you are very worried. Do anything crossing your mind? What could be the reason?
Doctor, maybe he's having a lazy eye or some sort of weak eye.
Okay. I will come back to this point later. And which in which way you want me to help you today?
Uh, Doctor, I just want some sort of assurance that he's doing very well.
Okay. And apart from his eyes, do you have any other particular concern?
Doctor, I'm just worried maybe he will be getting bullied at school.
Bullied at school. Okay, I hope it will not go like this. And how this thing impacting his life and your life as well.
Doctor, he's very small. It is not impacting, but it is impacting me. But because I'm worried that he might lose his eyesight.
Okay. I will try my best to help this thing. Okay, Mrs. Shahanas, let me quick recap. You have come to me to discuss about your son's Ali's condition. You notice he for last to 6 months he is having this problem in his eyes, and you are very worried that he might be get bullying and it can affect his problem with his eyes. And you want me to help you in the best way. Anything else you want to add?
That's it, doctor.
Okay, so Mrs. Shahana, so for what you have told me, and after seeing the pictures, it looks to me that he is having a condition. Though I'm not sure, but according to history, it looks like it's strabismus, which we called in the squint. Do you have any idea what is it?
No, doctor.
Okay, it means that it could be. It means that the both of his eyes are not matching together to see the objects. To That's why his one of the eyes is getting not aligned together. So there could be so many reason in behind it. There could be if he has any issue with the power of his eyes, like short vision or long vision, or it could be due to the family history as well. So for that reason, I would like to book an appointment with the eye doctor specialist so that they can check his eyes and they can give you more details about his problem. Are you getting me?
Okay, doctor. So what is Dr. Step-Space, doctor? What is this?
It's a squint. Squint means whenever our eyes is not aligned together, and one of the pupil it goes inside the towards the nose.
Mm-hmm.
Okay, so we can don't worry. We can manage this condition by checking. First, we need to confirm it by checking with the eye doctor specialist first, and they will give you some options. After confirming it, there are so many options they can give you. Like there could be glasses, there could be some exercises of the eyes, or it depends on the eye doctor specialist.
Mm-hmm.
Okay, and you are very worried that it could affect bullying, could be he can face bullying. So let me tell you, you can involve the teacher as well, and you can discuss his condition with the teacher, or I can talk with the you can bring the teacher to me. I can talk to him so they can explain his this eye issue to the school. So I think that's how we can defend from any kind of bullying.
Doctor, it will be corrected without any surgery. Doctor, I'm scared of surgery.
Well, yeah, surgery actually it's not usually. First of all, first it needs to be seen by the eye doctor. After we will first they would like to correct it by the glasses. If it is not working, then maybe we can hope for the best that maybe we can correct it by glasses. If God forbid no, then there could be options for surgery as well.
Okay, doctor.
Okay, so you can please next time bring your son to me so that we can book an appointment with the eye doctor specialist. And after that, we would like to follow him again to see about how he is developing with this thing. Are you getting me?
Okay. Okay, doctor.
Okay, thank you. But I
Well,
don't have, doctor, I don't have any idea what is it.
doctor, it was just great. Okay, first of all, this is the best thing you asked, but in the history, just you have to add one more point. Um, the direction. Okay, so mother might say that my child having left eye sometimes moving, it turns inwards, or right eye sometimes turns inwards based on that one. So then frequency, okay, not constant, seems intermittent but more frequently recently. Okay, so because he started going school, he started using the tab or whatever, so on. So, mother already told about visions and other symptoms. You asked very well, birth history, you asked vaccination, family history, everything you touch. Ideas, very well done. Examination, though it is not required over here, but likely diagnosis you could explain very well. But explaining the diagnosis, you should not go with over promising. Okay, they might ask, SP might ask you over promising. Okay, so over promising is not your domain. That is by the specialist, not by you, huh? Here you're going to refer, but not as an emergency, urgently, but not an emergency case. Okay, so you can explain that Mr. Master Ali, Mrs. Shanaz, I'm suspecting that from the picture and from the history you described, Master Ali is suffering from the condition we call it squint, which means that his eyes are not always pointing in the same direction. particularly the right one turning inwards. For example, if mother is telling the history of our right eye, so you have to talk about right eye. If your mother is saying the left eye, so you have to talk about left eye. Okay. Often this is related to needing the glasses to focus properly. Okay. When the eyes have to work hard to focus, one may start turning in. Okay. The important thing in that we get her eyes tested properly now because in one eye it is not being used as much. The vision in that eye uh, can become weaker. Okay, we call it lazy eye. Are you getting me? As his uncle was having the problem, as you told that he need a patching over there. Okay, this is much easier to treat, and while he's still young. Okay, so I'm going to refer you to the pediatric ophthalmology, or you can say the ophthalmologic. Okay, and I'm
Mm.
giving you 2 weeks referral. Okay, so what they will do, doctor? They will do, Mrs. Shana, they will be doing the formal visual acuity testing. They will measure the squint angle, and they might perform some sort of refraction or assess the refractory error, and then they will decide what kind of treatment he needed. Doctor, what kind of treatment do you think that is surgery? No, 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 Mr. Shanaz. It is not like, say, at the first point surgery. So they might start from the glasses, then patches, as you say that his uncle had some sort of patches. That might be the possibility, and possibly surgery in the later stages if this is not been corrected by other measures without any surgery. You getting me? So now here you should not reassure that it will grow out of it. Okay. So you have to emphasize that early treatment window, that we get much better result if we treat it now than if we treat until she is older. Okay, so referral is important at this point. So you have to emphasize that I'm going to refer you to a specialist. He or she is going to treat you over there. Safety netting, you can say about it that. If your child develop eye pain, sudden visual loss, abnormal white corneal, abnormal white reflexes on the photos, and neurological sign like say he is having unsteady gait or severe headache complaining, then you have to come back, or you have to go to the emergency directly. Okay, so reassurance that you have to say that Mrs. Shanas, many children with the similar squints do very well with the glasses, and sometimes there might be the chances of patching also, but let me be clear that it is a treatable cause. Early intervention in this age gives the best chance to best chances of good vision in the both eyes. You're getting me? So that was for you, Doctor. Or
Dr. Imran, you
yes,
were
doctor.
saying lazy eye. I'm not getting actually in the when I was doing the class. I'm not getting what is lazy eye and this patching. This is for what?
Doctor, for example, if I am the one who is having squint, okay, I'm looking at the tab, so my eye will be weaker. But suddenly I'm removing my tab and I wanted to look far away so that my eye, which is affected one, like say for example, right eye having squint, so it will take little bit longer time to get into position.
Okay.
Yes, this one we call lazy eye. Lazy eye means that muscles are so weak to get back to the reflection, so we call it lazy eye.
Mm-hmm. Okay. Okay. And these patches,
Dr.
how can?
Imran, can I speak? Do you see,
Yes,
Dr.
yeah,
Luri, they
doctor.
will,
Yeah, Dr. Snober will
yes, as
talk.
Dr. Imran said that they will do patching. So you know why they are doing patching? Because they will do the patching of the eye, which is lazy, which is not lazy, like active eye, and they will keep
Hmm.
the lazy eye. For example, squint eye, they will keep the open, so that kid will use that eye. So they are doing this patching for maybe 1 week, and they will instruct the parents that keep this patching there so that they can use this lazy eye. Lazy eye means the other eye, which is squinted. Understand?
Okay. Okay. Thank you, doctor.
So that's why they are doing this patching of this eye, because they want them to make the use of that eye, that lazy eye. Lazy eye means they are not able to, they don't, what's that called, vision. They don't take care, use proper use of that eye properly. That's why they are doing patching, so that they can use that eye, they can move that eye, and that vision will be proper. That's why
Okay.
he's called.
Yes, Dr. Snober. Thank you, Dr. Snober. Now, let's move to Dr. Sadka. Dr. Sadka, are you ready? Who else is going for? Anyone else is going mm, for February? Dr. Nadia. Okay. Dr. Ruhullah, again, shall I give you case?
Yes, Dr. Imran, I'm going for duty right away. 10 minutes, 5 minutes
Okay.
remaining.
Okay, Dr.
Sorry.
Dania. This is very interesting case, doctor. Who wanted to do?
Me.
Okay, Dr. Hoor, you can do. Dr. Sunobar, when your turn will come, I will give you. Don't worry. There's a chance. But Dr. Hoor, again, your case is there. This patient is. Let me talk about the case. This patient is Mr. Fahad Khan. He's a 45 years old gentleman. Uh, he come to discuss his problem with you and take proper history and manage the case.
Okay, Mr. Khan.
Start. Mr. Fahad.
Hello, Mr. Hello, good evening. I'm Dr. Hu. May I confirm your name and age, please?
Doctor, I'm Fahad, 45 years old.
Okay, Mr. Fahad, how can I help you today?
Doctor, the left side under my jaw is really painful and swollen, especially when I eat.
Okay, Mr. Fahad, I can understand that you are in the pain, but could you tell me more about your symptoms?
Doctor, I have noticed this problem 3 days ago,
Hmm.
and pain is really worsening. And this is under my left jaw, doctor. And it's like say continuously dull most of the time. And when I'm eating, doctor, it's really sharp, unbearable pain, doctor. I can't eat.
Okay, okay, I'm so sorry to hear about your pain, Mr. Fahad. Is it okay if I ask you a few more questions so that I can help you?
Sure, doctor.
Okay, so could you please tell me what is the pain feel like? What kind of pain it is?
Doctor, it's a dull when I am sitting, but when
Hmm.
I'm eating, especially when I'm eating that what you call it sour food or maybe acidic food, no, it's slightly doctor killing me. It's like say, feeling sharp pain. I could say that it's unbearable, doctor.
Okay, so only it's related to the sour food. What about other kind of food or anything chewing? This makes also the pain.
No, doctor.
Okay, and apart from this, okay, with this, does the pain radiating any other parts of your body?
No, doctor.
Okay, it's on your both jaw or only one side of your jaw,
One-sided, doctor, left side.
left side. And do you have any ear pain with this?
No, doctor.
Okay, any blurring of vision?
No, doctor.
Okay, any headache?
No, doctor.
Okay, and it's been 3 days. Before 3 days, anything happened?
Doctor, I don't feel anything. Uh, But I started feeling that my left side feeling little bit tight. Overall, mouth is bit dry and when I'm getting the pain. Otherwise, it's fine. I feel that some sort of bad taste in my mouth.
Bad taste in your mouth. And do you have any history of any flu-like illness recently?
No, doctor.
Okay, any do you notice your nose is always blocked
No, doctor.
or anything flow back your throat?
No, doctor.
Okay, okay. So, Mr. Fahad, do you have any history of any chronic illness like high blood pressure,
No, doctor.
high blood sugar?
No, doctor.
Okay, any other significant illness?
Doctor, occasionally I'm getting headaches, only that's it, doctor. But nowadays I don't have any headache.
Occasionally you have this headache. Okay. Is the headache, are you taking any medication for the headache?
Doctor, sometime I'm taking this paracetamol tablet.
Paracetamol tablet. Okay. And you told me that you noticed something with your eyes. What exactly you mean that?
No, doctor, I didn't notice anything, doctor.
Okay. So, do you have any night sweats?
No, doctor.
Any fever?
No, doctor.
Any weight loss?
No, doctor.
Okay. And anyone in your family has any significant history of any medical illness?
No, doctor.
Okay. And what do you do for living?
I'm a taxi driver
Okay. And whom do you live with at home?
with my wife.
Okay. And do you smoke?
Yes, doctor.
How many years and
Doctor, I'm smoking almost 20 years, 20 cigarettes daily.
okay. Have you ever thought of quitting smoking?
I tried, but couldn't.
You couldn't. Okay. Mr. Ahmed, Mr. Fahad, it's very important to think about the quitting smoking because smoking can do so many hazardous effects of our body. Right now, I can give you a leaflet so that you can go through. If you think of quitting smoking later, we can help you regarding this. Is it okay?
Okay, doctor.
Okay. Do you drink alcohol?
No, doctor.
Okay. And what about your weight? Did you recently check compared to your height?
No, doctor, I didn't check.
Okay, so Mr. Fahad, what do you think? What might be the reason of this pain?
Doctor, maybe infection of my gland.
Infection of your gland. Okay, and what exactly you want me to do for you today?
Doctor, I just wanted to get some pain reliever.
Pain reliever. Okay, and you are very concerned of this pain. Apart from this, any other particular concern?
Doctor, I just worried about infection could spread.
Okay, I hope it will not go like this. And how this thing impacting your life?
Doctor, I can't eat my favorite food.
Favorite food. Okay, what is your favorite food exactly? May I know?
Doctor, I like to take spicy food and sour food.
Okay. I will try my best to help you. So, Mr. Ahmed, let me quick recap. You have come to me because for last 3 days you are feeling this left jaw pain whenever you eat any kind of soury or spicy food, and you think it's an infection, and you want me to give you some pain reliever, and it's really impacting your life, especially you cannot eat your favorite food, which is a spicy food. Anything else you want to add?
That's it, doctor.
Okay, so is it okay if I examine you?
Sure, doctor.
Okay, in the presence of chaperone, I would like to check your general examination, pulse, blood pressure. Then I would like to check your eyes, and I would like to see your mouth. Can you please do ah for me? And I would like to see your inside of the mouth as well, your gums, your teeth. Is there any infection, any redness, bulging of gums is there or not? Then I would like to check your necks to see the palpate the lymph nodes. Then I would like to move your, can you please move and open and close your mouth so that I can see the movement of your jaw. And also I would like to see your uh, lung bases, to listen your lung bases.
Okay, doctor. Examination. Temperature normal, vitals normal. Patient having visibly swelling in the left submandibular region. On palpation, the left submandibular gland feels enlarged, tender, firm, but not rock hard. Okay, overlying skin feel warm, but not very erythematous. No fluctuations, flatulence, okay, fluctuations, okay. And the right mandibular, submandibular gland is normal. Okay, intraoral exam shows that mucosa normal, duct opening normal.
Okay, Mr. Fahad, so far what you have told me, and after doing the examination, actually, I'm not sure what is the cause behind this, but it looks to me that there could be some differentials. It could be some viral infections like mumps, or it could be some infections in your teeth or gums as well. So for that reason, I would like to make an appointment with the ENT doctor specialist, and to see to know what is the reason behind it. And for your pain, I can give you some anti-inflammatory painkiller, which is called ibuprofen.
Okay.
But before the giving ibuprofen, I would like to know, do you have any history of any drug allergy?
No, doctor.
Any acidity problem in your tummy?
No, doctor.
Okay, so you can take this ibuprofen, 400 milligram, 3 times a day for 3 to 5 days. Then we would like to the ENT doctor specialist, he will assess you and he can give you the actual answer, what is the reason behind it. And in the meantime, you can eat some food which is not spicy, which is not salty or soury food. You can avoid for some days.
Okay.
Whenever the swelling will come down, that time
Okay.
you can eat your favorite foods. So
Mhm.
okay, so and in the meantime, I would you can apply some hot cold compression over your neck so that the swelling also come down a little bit. And
Mhm.
I would like to see you again when you visit from the ENT doctor. And in the meantime, if you feel severe pain, you cannot swallow the food, or you have fever, any weight loss, or any change of your voice, that
Okay.
you need to come back to me immediately.
Okay, doctor.
Okay.
Okay. Well done, Doctor Hoor. This is diagnosis what you tell or mention?
Doctor, actually, I don't have idea. I think is it angioedema, or I told mumps, or it could be some problem with the teeth or gums.
Okay. Doctor, in this case, agenda was to know about whether he had childhood mumps or no. Okay, he didn't have childhood mumps. Okay, this one we call it Mr. Jamal. You have a swollen and red inflamed salivary gland under your jaw. Salivary gland makes saliva, okay, which drains into mouth through a small tube. In your case, a small stone has formed in the tube, a bit like a kidney stone, and is blocking the flow of saliva. So I'm suspecting the diagnosis, what you call it, salivary gland stone. Okay, you can say in a way. Otherwise, you can say someone can say that sialodithiasis. Okay, but the thing, if you are unable to pronounce that one, you can say that I must have suspected that inflammation of the gland, salivary gland, or salivary gland stone. Okay, so either one you guys can talk about. Okay, and apart from that one, you can say that in case this is quite common, okay, and it is not behaving like a typical cancer are you suspecting, because you have to address the patient concerns and ideas. And painful swelling associated with me is not a long-standing hard fixed mass, but persistent or typical atypical swelling. Okay, so here you're going to decide setting whether you're going to send as an urgent hospital or community like say specialist center. Okay, so systematically mildly unwell patient only, no airway compromise, no severe trismus or no spreading floor to mouth cellulitis. So here this presentation, okay, so suitable for initial community management with the safety netting. Okay, so if like say patient having fever, rigor, sepsis signs, and rapidly progressive neck or floor mouth swelling, difficulty in swallowing, slava or breathing, suspicions of deep neck space inferior or Ludwig's angina, you might refer as urgent referral. Conservative management is a hydration. You have to keep hydration increase. Here you have to ask how much water you're drinking. Okay, and stimulate saliva. Okay, suck on sour sweets. Okay, lemon slices or sugar-free chewing gum. Okay, help to flush the duct if the stone is small or movable. Okay, Dr. Hoor. Then you have to say that gland massage or warmth. Okay, here gently massage the gland from the back to front along the duct several times per day to encourage the drainage, warm compression over the area to improve comfort and promote flow, and good oral hygiene, regular toothbrushing, antiseptic mouthwash if needed, address any dental problems via dentist. Okay. Doctor, for because there is a tenderness, Doctor Who, so and patient might have if like a patient having low grade fever or a prolonged or viscous saliva. So we might be thinking, we might think that it's patient having infected, swelling along with obstruction. Okay, so we have to we can prescribe some sort of oral antibiotic for common organisms like Staph aureus or oral flora as per the local guidelines. Okay, then we have to discuss completion of the full course, possible side effects, and use a paracetamol plus minus. You can give NSAIDs. Okay, when to refer and how to refer to ENT or oral surgery. Okay, you should decide ENT or oral surgery if patient don't have improvement in 48 to 78 hours despite appropriate conservative and antibiotic usage, and recurrent episodes of salivary colic or saltinitis. Okay, and palpable or radiologically confirmed stone that is unlikely to pass spontaneously, like a large stone or proximal stone, and suspicions of tumor. If patient is elderly, patient having tobacco chewing history, or patient is taking some sort of, um, some keeping some, chemical thing in the mouth, whatever, so on. Okay, persistent painless firm mass, facial nerve involvement. Why, when we suspect the tumor, doctor, when we have patient having persistent, painless, firm mass, okay, facial nerve involvement with asymmetrical hard gland. In this case, for example, in this case, doctor, you can give non-urgent referral. Okay, ENT might do some imaging, they will do ultrasound, and they will be removing that what you call it, this stone.
Okay, Dr. Imran, actually, this is a new case for me. I have lack of knowledge.
Okay.
So
Doctor, there is one more case is there for you. Anyone who's for that one, because it will be last case of the day for February exam, because I think the only two or three February
Sir, can
candidates
I
are
present
there.
a case?
Yes, Dr. Kumar.
Yeah,
Dr.
sure, sir,
Imran,
sure.
Dr. Imran,
Yes,
one last
doctor.
question. This case, what I did, do I need to do any investigation like to CBC, CRP, anything?
No, 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 doctor. That's one wonderful thing that you didn't need anything.
Okay, okay.
हाँ भाई थोड़ा
Okay, doc.
1 second सर 1 second. हाँ ओके सर रेडी सर.
Okay, Dr. Kumar, your patient is 24 years old.
हम्म.
Miss Tahira, come to discuss her problem with you. Take proper history, examination, and management plan.
ओके सर रेडी सर.
Okay. Uh, okay, start.
Hello, I am Dr. Kumar, one of the GPs in the GP surgery. Am I talking to Miss Thyra?
Yes, doctor.
Yes, can you please confirm your age?
Doctor, I'm 24 years old.
And how can I help you today?
Doctor, my right side of my face hurts.
I am really sorry to hear about that. Are you comfortable to me talking right now?
Yes, doctor.
Okay, so please tell me more about this.
Doctor, my right side of my face hurts and really
Uh,
hard.
okay, and do you want to say anything on this?
Doctor, it's really hard. Doctor, I can't. Doctor, it's like look like I have really bad ear pain, doctor.
Ear pain as well. Okay,
I feel that
okay.
my ear blasting, doctor.
Okay, okay. Don't. Okay, so since when it all started?
Doctor, it's been 15 days, doctor. I feel that it's really painful, doctor.
Okay, and is there okay? So has it got worse since then?
Yes, doctor, it's really hard for me, doctor. I can't do anything, doctor. I can't eat, I can't talk, I can't yawn, doctor. It's
Mm-hmm.
really painful in my ear.
Okay, and is there are you able to open mouth?
Yes, doctor, but they're very hard, doctor.
Okay, so does this pain goes anywhere?
Uh, Doctor, no, it's like it's just on that side of my ear, on
Mm-hmm.
my jaw area, or maybe my
Mm-hmm.
neck pain, doctor.
Okay, and 2 minutes, 2 minutes. And how would you describe this pain? Is it throbbing pain, sharp pain?
Doctor, if I'm sitting now, I'm not talking to you, I don't get the pain. I just get discomfort. But when I'm opening mouth, really someone is killing me with a knife, doctor.
Okay, okay. So it is knife-like pain. And have you any recent fever and flu? Better, better.
No, doctor, I didn't have.
Okay, and do you have any weakness in any part of the body?
No, doctor.
Do you have any headache?
No, doctor.
Any recent trauma?
No, doctor.
Any rashes on the face?
No, doctor.
Okay, you said it is on the which side of the face?
Doctor, right side.
And what about left side?
Doctor, left ear, left side of ear, my okay, doctor. It's okay.
Okay, so okay, is there any discharge from the ear?
No, doctor.
And do you used to clean your ear with something?
No, doctor.
Is there any dizziness?
No, doctor.
Okay, okay. So has this happened for the first time?
Yeah, doctor.
Okay. Some questions regarding your past medical history. Do you have any long-term medical condition like high blood pressure,
No, doctor.
high blood sugar?
No, doctor.
Okay, and are you on any long-term medications?
No, doctor.
Any drug allergy?
No, doctor.
And what do you do for the living?
Doctor, I'm teacher.
So has it impacted your work?
No, doctor. But I can't talk,
Mm-hmm.
doctor, at work.
Mm-hmm. And has it impacted your mood as well?
Yes, doctor.
So how are you coping with this?
Doctor, it's very hard. I can't drink. I can't eat, doctor. I can't open. I
Mm-hmm.
can't talk, doctor. It's painful, doctor. It's
Yes, I
very
can understand.
hard. Doctor,
Yeah,
it's
yeah.
really
So we are here
hard.
to help to our best level. So, okay, some personal questions. So, some questions regarding personal habit. Do you smoke?
No, doctor.
What about alcohol?
No, doctor.
Okay, these questions might be sensitive and intrusive. So, are you sexually active?
Yes, doctor.
And are you using any pills?
No, doctor.
How has been your periods recently?
Fine, doctor.
Okay. So, okay, now, so Miss Tyra, you mentioned that since 15 days you have the pain in the jaw and as well as you have pain in the ear. And have you taken anything to make it better?
Doctor, I took this tablet, paracetamol, doctor. It's not helping me.
So based on the information which you provided me, what do you think could be the reason for this?
Doctor, maybe my eardrum is not good.
Okay, so are you able to listen properly?
Yes, doctor.
Okay. So and what is concerning? What is worrying you?
Doctor, I don't want to become deaf.
Okay, and why do you think like that?
Doctor, this is on the ear side, no, doctor. It is
Oh,
affecting my ear, doctor.
okay. And do you use any ear aids? Anything earbuds?
No, doctor.
Okay, so in order to have better understanding of your condition, I need to check observations, which includes the temperature, blood pressure, respiratory rate, waist height. Also, I need to sanitize my hands and want to check your general physical examination with a more focused examination on the ear. I shall, through an instrument which is called otoscope, I shall palpate the external ear. Also, to look inside of the ear, I shall also do general. I shall also neurological examination of the face, facial nerve,
Yeah.
vestibular nerve, and I shall also do Rhine test, vapor test. Okay, and I shall sanitize my hand again.
Anything else, doctor?
I want to do some that's all. Is there any vision problem?
No, doctor.
Okay, that's all.
Okay, examination all normal, except patient TMJ inflammation.
Implement. Okay. So based on the information, okay. So do you okay? So do you use some? Do you chew something by your? Do you use chewing gum?
Yeah, doctor, I'm having this habit of chewing because I feel that it will help me from bad breath.
And do you put some hard objects in your mouth?
No, doctor.
Okay.
I
So
just
this
try to open. Yes, doctor, you will remind me. I try to open one can the Pepsi bottle.
okay. Do you use it? Do you open regularly?
No, doctor, this is the first time I did.
And since then this pain came.
Huh?
Since then this pain came.
Yes, doctor. Since then, I think so. This came after that, doctor.
Okay. So I think you have a condition which is called with temporomandibular joint inflammation. Do you have any idea about this?
No, doctor.
Okay, this is a condition in which we have a joint below the ear, which attaches our lower jaw to our head. So it is a, this point bears the maximum pressure while biting. Am I clear so far?
Okay, doctor.
Yeah, so whenever we put a pressure on this by biting hard things, so it gets pain and it causes inflammation of the joint.
Okay, doctor.
Yeah, so am I clear so far?
Doctor, yes.
Yeah, so it is a treatable condition. What I'm going to do, I'm going to give you a tablet, which is called ibuprofen 400 milligrams, 3 times a day
Doctor, I'm
for
allergic.
5 days.
To NSAIDs, doctor.
Okay. So I'm going to give you a tablet, which is called paracetamol 400 milligram, 4 times a day for 5 days.
Doctor, I
Is
took
that okay?
already this one.
Okay, so there are some things which we can do except tablets. Like, can you avoid chewing gums?
Yes, doctor.
So
Give me some painkiller, doctor.
so I'm coming to that point. Okay, is it so you can avoid chewing gums and please never try to open that cans. Always try the opener. Is that okay with you?
Okay, doctor.
Yeah, and also right now I'm not sure about the okay. There is one painkiller which is called codeine. So I'm also giving you codeine. Is that okay?
Doctor, it will be sleepy, doctor.
No, yeah, it will. So I'm giving you in a normal dose. It will not cause sleepy. Usually, some drowsiness happen, but whenever you feel drowsiness or do you any constipation, you can come back to me again. Is that okay?
Okay, doctor.
Yeah. So I also, if you feel that you are the pain is increasing, not relieving with this tablet, and there is difficulty in opening mouth, please get back to me or need to nearest hospital. Is that okay?
Okay, doctor. Okay, doctor. So how long
Also,
it will take, doctor?
so it will usually take 1 to 2 weeks to settle, and also eat
What?
a normal soft food.
Okay, doctor.
Yeah. Also, I'm giving you a leaflet about this condition. Later on, if you have find any difficulty in understanding this, you can come back to me or you can call me.
Okay, doctor.
Okay, thank you for. Is that you have any questions so far till now?
No, doctor. Thank you, doctor.
Okay. Do you want me to repeat what we have gone through?
Uh, Thank you, doctor.
Welcome, sir.
Okay, Dr. Kumar, give me 1 minute. I will be back.
Sure.
What is root 3 art style? On Google error. 3 art styles. 3 art styles. 3, not free. 3 art styles. 3 art styles. Art styles. I want to make it. With the pumpkin one, right? Yeah. Flower containers. Hey! Get off my chair. It's pumpkin one. Ah. This is a pineapple. Burj Khalifa. I know Burj Khalifa has an Eiffel Tower. Mama, even a kitty cat. A clock. Yeah.
How's too much of wrong?
Mommy, let's touch. Nothing underneath. Do that.
Okay, so Dr. Kumar.
Yes, sir. Yes, sir.
Okay, doctor. First of all, case was good, but you didn't ask about LMP, which was crucial to ask. Which is
LMP
being
outfit. Yeah.
Yes, doctor. And second thing, pain score.
Pain score. Yeah, yeah. I was about to ask, but forgot in the middle. Yeah.
And no, doctor, just do one thing. Whenever this a few days are here for the exam, so do one thing. Take one paper and write down
Mm-hmm.
some critical points. Okay, like say what you're going to ask from the history. If like say female is there, so after asking about HOPI, in between you
Mm-hmm.
can ask about LMP and followed by the past medical history and drug history and followed by family history and drug allergy and psychosocial eyes summary.
Mm-hmm.
Then if there is
Pills,
examination,
pregnancy. Mm.
yes. If yeah, that what you call it, what you say, doctor, then examination followed by then explanation, then management plan, and then safety netting. Okay, so you have to keep the paper, and when you do the practice, it will be more beneficial for you. That's what I did. This case was, doctor, May April 2024 2025 UA Karachi exam.
Mm.
The patient was very young. She
Okay.
was they keep on distracting. She was not like me, SP. She was very difficult SP. She was not giving the history to the doctors. Okay, he was keep on saying, "Doctor, I'm having ear pain. Doctor, I'm having ear pain." Until unless patient was, if your doctor is asking that whether you when you getting the pain. Okay, then she used to say, "Doctor, I am getting this pain while opening mouth." Okay, or chewing or
Mm-hmm.
taking food, this kind of thing, then you will be getting this is a TMJ. Okay, many doctor
Sure.
they put it as a otitis media or otitis externa, whatever, so on, but no, none of them. And one of the doctor, he given the temporal arthritis diagnosis, because here, ask about a clear history, that's mandatory. And drug history, mandatory to ask whenever you're going to give the treatment. Okay. Now, for the conservative management, this is the first line. Okay. You have to explain it is usually benign and often self-limiting. Okay. Here, agenda to know about how long it will take. Doctor, it take 4 to 8 weeks. Sorry, 6 to 8 weeks and 4 to 6 weeks also you can say, okay, with the conservative management, okay. So this one you have to tell, you should say that you have to avoid solid food, and you have to take semi-solid or liquid diet, avoid chewing gum, avoid the thing that which is causing you stressful, and if she's having a habit of clenching the teeth, so she should avoid. So this many things are there you have to talk about, okay, talk about. So doctor, we will be moving to our April candidates. So April candidate yesterday, Dr. Sonobar and Dr. Maeda, and one more doctor was there. She did perform. So today, Dr. Atia is here.
Sir, was it satisfactory?
It is satisfactory, doctor, but two things missing. Just make
Mm.
it habitual, so it will be pass.
Yeah, sure, sir, sure. I shall try.
Okay, yeah,
I
yeah,
shall.
yeah.
Oh, thank you, sir. Thank you.
Doctor, yeah, welcome, doctor. Dr. Atia is here. Doctor, who wanted to perform from April, other than yesterday's 2 or 3 doctors?
April?
Yes, April, Dr. Mona.
Yes.
Okay, Dr. Mona. Your patient is 39 years old. Mrs. Aisha Khan come to discuss a problem with you. Take proper history, management, and examination and management plan.
Okay.
Oh,
The
okay.
name of patient, Aisha.
Uh, Aisha.
Uh, Hello, Mrs. Aisha. I am Dr. Mona. How I can help you today?
Doctor, the veins on my legs are getting really big and ugly, and they itch by the end of the day.
Sorry, what is the problem?
Doctor, my leg veins getting
Mm.
big and ugly.
Oh, sorry to hear about that, Mrs. Aisha. Can you tell me more?
Doctor, I have just noticed that lumpy veins in my both legs about now it's been about 5 to 6 years. But it got worse when with my second pregnancy, doctor.
Okay. Mrs. Aisha, can I ask you some question?
Sure, doctor.
Uh, this from 6 months and now it's getting worse. There is any pain with it?
6 years, doctor. Yeah, it is. It's been 6 years, doctor.
Okay. There is any pain with this? swelling?
Doctor, I just feel that some sort of throbbing sensation and aching and heaviness, doctor.
Okay. Anything make it better?
Yes, doctor.
What is make it better?
Doctor, when I'm resting.
Okay. And when it's standing, it is increase. That is right?
Yes, doctor. When I lie down, I put one or two pillow under my legs. It feel better.
Any bleeding from it?
No, doctor.
Any itching?
No, doctor.
Any skin change around it?
No, doctor.
Okay. Mrs. Aisha, are you allergic to any medication?
No, doctor.
Are you on long-term medication
No, doctor.
or taken any medication recently?
Doctor, I'm taking COCP.
Okay. And you diagnosed before with any disease?
No, doctor.
Oh, okay. What do you do for a living, Mrs. Aisha?
Doctor, I'm hairdresser.
Uh, it is challenging job. That is it?
Yes, doctor.
With whom you live?
I'm living with my children and husband.
How things go at home?
Doctor, everything is fine.
Do you smoke?
Yes, doctor.
How many cigarettes per day?
20 cigarette daily.
For how long?
Doctor, 5 years.
Mrs. Aisha, you know, you have any thought to quit smoking before?
No, doctor.
You know, smoking is harmful for your health. I will give you a leaflet to read more. If at any time you decide to tweak, I will be more than happy to help you. That is okay with you?
Sure, doctor.
You use any drug for enjoyment?
No, doctor.
What crossed your mind about this vein in your leg?
Doctor, I was reading online, so it says that I am having varicose vein.
Okay. And what worry you the most?
Sorry, doctor.
What worry is you the most?
Just worried about any clots traveling to my lungs.
I understand your worry, Mrs. Aisha, and how I can help you in best way today.
Is there any treatment to get rid of them?
Okay, Mrs. Aisha, I will discuss this and how this impact your life.
Doctor, as I told you that I'm hairdresser, so I have to stand for longer hours. So it's really difficult for me to stand up.
I understand, Mrs. Aisha, it is very difficult for you. I will do my best to help you. Let me recap what you said. You came today because you have visible vein in your leg and worry about clot in your lung and expecting medication. There is anything else?
No, doctor.
Can I examine you, Mrs. Aisha?
Yes, doctor.
Can you stand for me and expose after sanitize my hand and there is good privacy. I will call Shafron to be with us.
Mm-hmm.
Can I expose your leg till the side?
Mm-hmm.
Can you stand up? I want to see. I want to take a look from anterior, posterior, and beside medial and lateral.
Okay,
Okay.
doctor.
Uh, can
That's it, doctor.
lie down. Can you lie down, Mrs. Aisha, in the in this bed?
Okay, doctor.
I will touch the both lower limb for
Mm-hmm.
temperature and
Mm-hmm.
any. I will look for any swelling first, then touch to compare and for any swelling. Then I will. Uh, Mrs. Aisha, I will take your two leg above
Mm-hmm.
and milk the your legs. I will put tourniquet. Can I?
Yes, sir, doctor.
Mrs. Aisha, now you can one by one. I will do tourniquet one by one, not both in the same time. And now you can 1 minute, sister. See the patient. I will observe for 30 minutes, then I will remove the 30 second. I will remove the tourniquet. I will observe then also for to calculate the second what refill the vein. That is okay.
Okay, doctor.
Mrs. Aisha, as you think, you have a varicose vein, and this is when there is leakage. There is vein in this vein. There is a valve. When it become loose, this blood will not go up. For that, make this condition. I'm clear for
Okay,
you.
Okay, doctor.
How about describe for you? So after I will do for you brachial ankle brachial in depth,
ABPI.
and if it is normal, how about use this stock? I will prescribe for you
Okay,
to
doctor.
wear it at morning when you woke up at morning, very thing,
Okay.
and at evening before bed to remove it. You can?
I can do it, doctor.
Yes, and it is better to take a rest from time to time to sit down. I will write for your employer for to give you some rest between
Okay,
your work.
doctor.
Okay.
Okay, doctor.
Mrs. Aisha, I would like to see you after 3 weeks. Also, I will reassure you. This is a clot is not this varicose is have not have a complication. Rarely make complication like clot in the leg in the lung. That is clear for you.
Okay, doctor.
How would about see you after 3 months? At any time, if there is bleeding from this vein or you notice any change in your skin, not hesitate to come back to me.
Okay, doctor.
You have any question?
No, doctor.
Thank you.
Thank you. And Dr. Mona, you used to practice in our previous group, am I right?
Dr. Imran, I have patient. I will close. I will hear you. I have
Okay,
patient
okay,
who
sure,
is bleeding.
sure.
I am
Continue,
in
continue.
duty.
Okay,
Yes.
Dr. Mona, well
I
done.
am hearing you, Dr. Imran.
Okay, sure, doctor. Okay, so doctor, I am going to get some sort of, all the thing in one frame. So there are a few things we have to remember. In this case, there are four parts are there. First of all, assessment in the primary care and conservative management and indication for the referral and overview of the interventional options. Okay, so let's talk about one by one. So in assessment, what we will be doing the history. So in this day, patient might present with a heaviness, aching, throbbing, itching, cramps, swelling, restless leg, or bleeding. Okay. Duration and progression based on that one, we have to ask about exacerbating factors. Maybe patient will be having prolonged standing pregnancy or patient working in heated environment. Okay. So in this way, you have to ask, okay, then about impact and function on the quality of life. Patient might present, say, doctor, I am working in a, what you call it, salon, or maybe I'm working as a model. I don't want to see my dirty legs, okay, because I have to wear skirt over there. I can't wear full trouser, whatever. So on that might be the agenda. So here you have to calm down and you have to tell a little bit different way. Okay, then past history, if like the patient having DVT, leg trauma, surgery, previous vein procedures, and again we have to ask about red flags. Red flags can be doctor sudden pain, swelling of the lymph, and skin breakdown and infection. These are the 4 or 5 red flags are there. examination after taking the approval, taking, patient's consent. After that, you are going to say the patient inspect standing. First of all, inspect standing. Okay, from standing, what you will be seeing, taking the constant, expose the patient leg just middle of the thigh, as Dr. Mona did, and distribution of the varicosities. Okay, reticular or spider veins. You have to look for edema, skin changes like say venous eczema, hyperpigmentation, or what we call it, atrophy balances are there. You can see about ulcers. Any low ulcers are there, then in the ulcer we have to see where is the location, size, depth, and exudate, and palpate for the tenderness and cords and warmth. Okay. Now
Okay.
again we have, yes, doctor.
I do the examination, right?
You did examination very right, but you forgot to ask about LMP and
Yes,
drug
but you
allergy.
said the cook. Yes,
Okay, so otherwise, now again check peripheral pulses. Okay, exclude significant arterial disease if thinking about compression. Okay, so you have to talk
yes, sure.
about, okay, if you suspect DVT, um, then acute painful swelling, tenderness, and risk factors divert into DVT pathway rather than a routine varicose vein management. Okay. If patient having painful swelling, tenderness is there, risk factors are there. Yesterday we have discussed already, and conservative management appropriate for mild or cosmetic disease. Like say patient might come, as I told you guys, that patient don't want to see her legs dirty, and because she have to wear the skirt or because of her profession says. Okay, while maybe she is an air hostess, whatever, so on. While awaiting for the specialist, you can give the conservative management. Patient unfit for intervention or who decline procedure, patient don't want to go, then you can give. Okay. Then general measures, you have to tell the patient leg elevation when resting, avoid prolonged standing or sitting with the leg dependent, or encourage walking. Okay. Weight reduction if patient is obese. You have to ask about BMI, Dr. Mona, and regular
Yes,
calf muscle exercise. Now compression. Graduated compression stocking knee length usually sufficient if patient don't have significant peripheral arterial disease, like say we have to check ABPI or pulses in if you are in doubt. Okay. Uh, Compression will help the patient with the symptoms and edema and essential in venous ulcer management. Okay. Explain that stockings are supportive, not a curative. Okay, this is not a treatment. It's just like say supportive management. Okay, then they will be there. You can tell that it can reduce the symptoms and complication, but do not remove the veins. You're getting me. Okay, skin care. If patient having dry skin, then you can prescribe some sort of emollients. Okay, topical steroid for short-term usage for varicose eczema, or if like say if it is needed, and good ulcer care. Okay, if like say patient having ulcers are there, conservative therapy alone is reasonable if symptoms are mild in the problem, and the problem is a cosmetic, assuming no complication. Okay, so when we are going to refer the patient, that is an important task again. Okay, common indication include, doctor, that symptomatic varicose vein causing significant discomfort, heaviness, or functional limitation despite of conservative measures. Okay, complications of chronic venous disease, like say skin changes, doctor, eczema, okay, lipodermosclerosis or hyperpigmentation, healed venous ulcer, active venous ulcer, and recurrent superficial thrombophlebitis in varicose veins and bleeding from varicose veins. Okay, rapidly worsening varicosities or diagnostic uncertainty. And
okay,
urgent referral only, you can do it if patient having bleeding varicose vein that is difficult to control, suspected DVT or acute limb ischemia, or infected ulcer or systemic features are there. Okay. And for the counseling purpose, you can say what they will be doing. They will be doing endothermal ablation. Okay. Don't say surgery. If you say surgery, patient might be saying, doctor, I don't want to cut my limb. Okay, ultrasounded guided foam sclerotherapy and mechanochemical or cyanocrylate systems are there, which whatever, so whatever you want to do, you can discuss it. Okay. So key counseling points are there. Goal is symptom relief and prevention of the complication, not just cosmetics. Okay, one. Number two, recurrence can occur over the time due to progression of venous disease, and post-procedure compression and immobilization are usually advised. Okay. So you can explain like say symptomatic veins in your right leg with or without skin changes, ulceration. There is no red flags or DVT or arterial disease. So I am just going to do so and so stuff. But if you're having still problem, please come back to us. You can go for the you can ask about safety netting.
What about
Okay,
cook?
doctor.
Can change or she can continue on cook?
Yes,
Cook,
she
she
Combine
can
could
do it.
combined oral contraceptive pills.
Yeah. Okay, doctor, who is
I
next?
didn't ask Dr. Amran
Yes, doctor.
about cook. What you said about cook?
Cook.
Combine pills.
Yeah. We are talking
I
about
didn't
combined
hear
pills.
your answer.
No, I didn't answer you
Yes,
actually.
this patient.
Okay, for this patient, doctor, if like say patient is taking this COCP, so then we have to see. Like say patient mother, if we have to see the family history. Family history also DBT is there, no?
Okay.
Okay, so
I quick answer about family history. Yes.
yes, you forgot to ask about family history and
Last ministerial period.
yes, menstrual period was there, and we are going to refer this patient, but you forgot about that COCP. That was in my
Yes.
agenda. Why I didn't put? But you will do, Doctor
If
Mona?
I will,
Doctor, in
if there is
COCPs,
family history of
COCPs are not contraindicated. They are contraindicated in DVT, right? Varicose
Yes,
veins,
doctor.
I think it's okay.
No, we can give, doctor, because
Yes,
in
we
my
can.
agenda there's
It's
nothing
okay.
such thing, doctor.
Yeah. It's not contraindicated. Can continue.
Okay, doctor, who want to do next?
Excuse me, sir. What about the investigation? Can we do the ultrasound or not?
Doctor, we will be referring to a 2 weeks referral or normal referral to the specialist,
Okay,
vascular surgeon.
okay. I mean, specialist will do further investigation. We will do
Yes,
only
doctor.
conservative. Okay.
We will be doing only conservative, doctor.
Only okay. Thank you.
What's your good name, doctor? Because I'm unable to see this.
My name is Asba Sajid.
Okay, Dr. Asba, are you ready for the case?
No, sir. I didn't prepare because the day I first joined.
Okay, doctor. So anyone else wanted to do it? Okay, Dr. Sunobar, ready.
Doctor, I have patient now.
So no one is there?
I have patient.
Okay, Dr. Maida,
After
please.
10 minutes, I can do. 10 minutes.
Sure, doctor. Sure, doctor. Okay, Dr. Maida.
Yes, sir.
Dr. Maida, your patient is Mr. Adam, 27 years old gentleman, come to discuss his problem with you. Take proper history and manage the patient. Examination is great. Means like say, if you feel that you can do it, otherwise, if not doing also not fine.
Okay.
Okay, Dr. Maida,
27
please.
27 years
Ye-
old, Mr.
Adam.
Adam. Okay.
Okay, start.
Okay. Hi, good afternoon, Mr. Adam. I'm Dr. Maida here. How can I help you?
Doctor, I fainted yesterday and it really scared me.
Okay, Mr. Adam, may I know some more details about your fainting episode?
Well, doctor, I was about to go home after my work. I was standing in a hot, crowded train. I suddenly feel funny and then I passed out. I remember the feeling like high, lightheaded, hot and
Mhm.
sweaty, and my vision went kind of blurry and dark around the edges, doctor. Next thing I knew that I was on the floor and people were helping me.
Mr. Adam, I'm sorry to hear about your condition where you suffered. If you allow me, may I ask few more questions?
Sure, doctor.
Okay, Mr. Adam, first tell me, is this is the first episode in your life, or you already had such kind of episodes in past?
No, doctor, this is first time.
Okay, Mr. Adam. You told me when you were about to pass out, you have some funny feeling. So may I know which funny feeling, like lightheadedness or something, nausea, vomiting also?
Doctor, I was feeling that lightheadedness, hot and sweaty.
Hot and sweaty. Okay. And then after that, you don't remember what happened with you.
Yes, doctor.
Okay. Mr. Adam, so was it very hot when you were walking?
Today, yes, doctor, temperature was, scorching high, and it was like say 39 degrees centigrade and bit humid
Okay.
actually.
Okay. Did you notice any, did you vomit or any incontinence of urine or anything else you noticed
Doctor,
while you passed out?
I felt nauseated.
Nausea. Okay. But you did not vomit.
Yes,
Okay. And no, any history of tongue bite or
no,
paralysis like that?
no,
Any
doctor.
history of fit while you passed out?
No, no, doctor.
Okay, good. Mr. Adam, do you have any disease like high blood pressure or
No,
sugar
doctor.
or
No, doctor.
okay. Are you on any regular medication?
No, doctor.
Okay. And Mr. Adam, may I know that you have some family history of any like epilepsy or high blood pressure, sugar?
No, doctor.
Okay. And Mr. Adam, may I know your job? What are you doing for your
Doctor,
living?
I'm a site engineer.
Okay. And your duty hours and
Doctor, I'm working morning till afternoon. I'm working in a
okay.
on
Mm,
construction site.
okay. And to whom are you living?
Doctor, I'm living with my friends.
Friends. Okay. And sharing accommodation.
Yes, doctor.
Okay. And may I know about your dietary habits?
Doctor, I'm eating everything.
Okay. And did you take proper food, breakfast, the day when you had this episode?
Yes, doctor. I'm very particular in this kind of thing.
Okay. And I want to know especially about your how much water you drink in one day or fluid
Doctor,
intake.
I'm drinking a lot of water, but I do remember that day maybe I had less water.
Okay. Maybe. Okay. Any history of kidney stone or kidney
No,
pain?
doctor. No,
Okay.
doctor.
Okay. And what do you think? What happened with you?
Oh, well, doctor, you're talking about my problem. Look like doctor, it's just venting from the heat,
Okay.
but I'm not sure,
Hmm.
doctor.
Yes. We will talk about it. And is it anything which is concerning for you related to this, or any other concerns you want to tell me?
So what if it might be a serious heart problem?
I hope not. We will talk about it. And what do you expect from today's consultation?
Doctor, just wanted to know what happened to me actually.
Sure, we will figure it out. Is it affecting you in any way, this episode?
Doctor, after that episode, since yesterday, I'm a bit scared now.
Yes, I can understand your worries. Um, is any stresses during your job or at home?
No, doctor.
Okay. May I know about your family? Are you married?
No, doctor.
Okay. Mr. Adam, do I want to ask that if you have a habit of smoking?
No, doctor.
Okay. Any alcohol
No,
intake?
doctor.
Any recreational drugs?
No, doctor.
any and about how about tea, coffee? How
I
much you
take a
consume?
lot of coffee.
Lot of coffee. And I want to know about your sleeping habits. Do you sleep properly?
Yes, doctor.
Okay. And I would like to summarize that yesterday you had this passing out episode. You were feeling fainting, you were feeling dizzy and funny feeling, lightheadedness along with nausea, and then you passed out. And when you after that you find that people were helping you, you were not aware that what happened with you. After that episode you were okay, and you are worried that this could be a serious condition, so you want to figure out that what happened with you. Am I okay?
Mhm.
Or would you like to add something?
That's it, doctor.
Okay. So, Mr. Ahmed, I would like to have your quick examination. Is it okay for you?
So, doctor.
Okay, thank you. I will sanitize my hand under complete privacy. I will do your general physical examination, your BP, pulse, temperature, and I will auscultate your lymph nodes and check for sure your thyroid glands and for anemia and jaundice. And I will auscultate your chest for aortic breathe as well. And I will examine your legs for any pedal edema as well. I will also auscultate your chest. Uh, any positive finding?
Examination normal.
Okay, Mr. Adam, based upon your history and journal or an examination which I have done, I have come to a conclusion that looks like you have a vasovagal syncope. Have you ever heard about it?
No, doctor. What is this?
Vasovagal syncope is a type of fainting out episode which can which is not a serious thing. It can happen to anybody in certain circumstances. For example, during while walking in a very hot environment, working for long hours, standing for long hours, especially in hot environment, sometimes our blood pressure gets down like below normal level, and that's why the blood supply to our brain become compromised, and we had this episode of fainting out. That is not a serious condition, I would say. It's a good thing. But I would like to give you some lifestyle modification, some advices, so you won't have this episode in future. Are you getting me?
So, doctor.
Okay, first of all, I would like to tell you that you have to be careful about your hydration, because it's as you told me that you have to work for long hours and you have to walk in a very hot environment. So I would like
Mhm.
to advise you to carry a water bottle with you. Try to hydrate yourself. Take enough water, at least 8 glass of water per day. And moreover, I would like to have you, as you already said that you take a proper diet, that is a very good thing. Please continue it. And also, when you are walking in a hot environment, better to take a wet towel on your head and take loose garments. If you are feeling very sweaty and hot, take some rest in a shady
Mm.
place and don't walk
Mm.
long in a very hot environment. Sometimes this episode can lead to maybe heat stroke or something like serious. So far it's nothing serious, just lifestyle modification and some measures you can take, and you can prevent from any further episode. In case you feel that your blood pressure is going down, you feel dizzy, and you feel some like unable to move your limbs,
Mm.
or you feel that your blood sugar is going down, something happen like that, you can immediately come and report in emergency.
Okay, doctor.
Moreover,
Time
you
up.
can take. Okay.
Well done, Dr. Maida. That good part was that one you mentioned, explain about it. This not to worry about this, and it's a good thing, which was which was really kind of promising to the patient. Doctor, we should not use this kind of word when we are counseling the patient. Okay.
Mhm.
Okay, and doctor, let's have a little bit study point of view from my side. What you're going to do in this kind of case is you presented very well. There was no flaw. There's nothing extra to talk about. But you have to do an ECG when you are taking this patient. Okay, all syncopic patient 12 EGs, 12 ECG is mandatory to do it. Okay,
Yes,
no
right.
matter whatever the situations are there. Okay, now
Exactly.
here, yes, classical vasovagal pattern patient will be presenting with prolonged standing history, emotional distress, pain, or seeing blood or needles, hot, crowded environment, and dehydration. Okay, so in this patient, dehydration was the one factor. Second thing, hot, humid climate, patient and crowded place was there. So prodrome over the seconds to a few minutes, it will be happening. Patient might be feeling dizziness, lightheadedness, then nausea, sweating, and feeling warm, pallor, and then blurring of vision or visual changes will be there. Patient might say blurred vision or tunnel vision or hearing changes. Okay. So loss of consciousness will be brief, less than 1 to 2 minutes, flaccid, often with a minimal or no convulsive movement, and rapid complete recovery. Uh, though may have washed out or fatigue afterwards. Okay, there will be a lot of things where patient might exaggerate, patient might tell you, but again, a few things will be catching. Okay, so there should be no tongue biting on the side, prolonged confusion, or incontinence suggestive of seizure. Okay, if there is a patient having this got seizure, incontinence, confusion, prolonged confusion, and biting of the tongue, these are the red flags are there. Okay, so it means it is not a syncope, it's a seizure. Okay, now important differentiation not to miss. Cardiac syncope, we are going to talk about again arrhythmia, structural heart disease, aortic stenosis, HOCM, and pulmonary embolism. Orthostatic hypotension, for example, autonomic cellular medication related in elderly patients. Patient is taking thiazide, diuretic, patient is taking a what you call it, any medication which is called like alpha blocker in elderly patients. Okay, and volume depletion. Okay, suddenly patient was working in a hot environment and suddenly he got it. Okay, and seizures and hypoglycemia with vertebrobasilar, okay, TIA. This is less common, but we can talk about in that one. Okay, so what you're going to assess the patient, past history, history presenting a less than past history, patient having known case of heart disease, for example, previous MI, heart failure, arrhythmias, structural heart disease based on the age, and the family history of sudden cardiac death or inherited arrhythmias or cardiomyopathies. We have to think about how come, and medication like say antihypertensive, diuretics, QT prolonging drug like say azithromycin and erythromycin, and beta blocker, antidepressant, and antipsychotics there. Okay, patient is taking the maybe some female patient who is having acne or skin problem. Doctor prescribed her that she have to take azithromycin 250 mg daily or 500 daily for almost 3 to 5 months. So they might he or she might present with such kind of peculiar QT prolongation in the ECG. So that's the reason ECG is important to rule out. Okay, then we have to see about frequency of episodes. Okay, and any injuries and impact on the driving, work, and pregnancy status. For example, if patient is pregnant, red flags in the history, syncope during exertion or supine, no prodrome, very sudden onset. Patient say, I didn't have anything. Suddenly, I lost my consciousness. Okay, patient having a chest pain, palpitations, dyspnea immediately before, and known structural heart disease or a strong family history of sudden death like the HOCM or you know uh, some other complicated problems. Okay, and prolonged confusion after event like say focal or neurological issues followed by basic investigations. Okay, always tell the patient, I will be checking your ECG, capillary glucose to check about sugar level and further test episode based on patient history. You can talk about full blood count, urea electrolytes if we are suspecting in female, a pregnant lady, or patient having some metabolic causes. So we have to consider. Okay, if the story is classical vasovagal exam, okay, and ECG is normal, we usually have enough for working diagnosis. Okay, so we don't have to think about more. Immediate management of an episode. If patient having a problem in the clinic or patient say it just happened, so we have to lie them on the flat and then ideally with the leg elevated, loose, tight cloths like the patient is like in a dangri, what we call it, this labor's dress or ensure airway potency and check blood pressure, pulse, capillary glucose and if patient already defended, recovery usually rapid and supine with the supine position itself. Okay, long-term management, doctor, you can educate the patient with reassurance. You can explain this is a common and usually benign condition due to the transient drop in blood pressure or the heart rate. Okay, the aim is to recognize warning signs early and prevent complete loss of consciousness where possible. So now how to talk about avoiding triggers and preemptive actions, okay? So based on scenario, again, we can say that maintain adequate hydration, consider increasing fluid and appropriate salt intake. If you don't say that you have to eat and drink salt all the time, avoid prolonged standing, especially in the hot environment, avoid skipping the meals and rapid position changing. And if triggers are predictable, okay, like say needles, patient we are scared of needles, stress because of emotional stress, advised lying down for the blood test or the procedure. Okay, patient say, doctor, I saw the needle, I fainted. Okay, so you have to take this blood, patient's blood, when patient is in supine position or lying down position. Okay. And when patient has say that our doctor, my episodes are frequent and I'm getting more troublesome, so we have to tell the patient keep the diary of the event, trigger, prodromes, and context. Okay, and consider the referral if patient having recurrent episode despite of good conservative measures and significant injury risks like say for example if patient is working in occupation where there is a machinery usage is there or a patient working with some sort of sensitive area. So, or patient is elderly having recurrent falls. So we have to refer this patient. And when you think that maybe I'm not able to diagnose, maybe this is a syncope or something else, I have to refer the patient. Okay. Now question arises, doctor, when I have to refer and when I can investigate. Okay. Now red flags that require urgent or semi-urgent cardiology or acute referral. If patient having syncope during the exertion or supine position, patient don't have any prodrome or very sudden onset and collapse with a very sudden of onset of the collapse and abnormal ECG like say heart block, long QT or Brugada's pattern or pre-excitation or ischemia changes. Structural heart disease like say patient having severe aortic stenosis, outcome or significant cardiomyopathy. Family history of sudden cardiac death at any age, at young age, sorry. And recurrent unexplained syncope causing injury. Okay, and syncope with palpitation immediately before. Okay, patient said suddenly I feel that my heart started beating very fast. So here I'm going. These are the red flags for urgent. Okay, these patient may need echo, Holter, or loop recorder or exercise testing until table test in the selected cases. Okay, neurology referral if you're suspecting patient having seizures, like say tongue bite, as I told you, incontinence, prolonged post-ictal confusion, or myoclonic jerks, non-consistent with convulsive syncope. Focal neurology or headache pattern suggestive of CNS pathology. Okay, these are the neurological referrals are there. And primary care summary, you can make it based on your pattern. So assessment history consistent with the vasovagal syncope triggered by a prolonged standing needles with a prodrome of dizziness and nausea, brief loss of conscious, rapid full recovery, and no exertional or supine episodes or chest pain, palpitation, and no concerning family history. Examination in ECG will be normal. So plan you can make it like this. Reassure about the benign nature as you did, Dr. Maida, and advise good hydration, avoid prolonged standing and triggers where possible. And what you call it, discuss about driving or work safety. Patient is working on that areas and safety netting, seek urgent review. So, doctor, that is our vasovagal syncope, Dr. Sanobar. So, anyone is ready now? Okay. So, doctors,
Dr. Imran,
yes, doctor.
how much was the temperature? 39 something?
This patient temperature, not it's outside temperature.
Okay, all right. Yeah, I was thinking about heat exhaustion or heat stroke, you know. I thought the
No,
temperature
no,
is
no.
39 body
Yeah,
temperature.
doctor, this is what we call it. What we call it? What we call it? Outside temperature, not patient temperature, doctor.
Okay, okay, all right. I thought it's 39 body temperature, so that's why I was confused why it's vasovagal.
Uh,
So.
no, doctor.
All right. Thank you, thank you.
And doctor, those who are going for April, what you call it, attempt, please start your practice now itself. Make your nerves, doctor. If you do mistake over here and you repeat your mistake over here, believe me, it will be corrected over here. Otherwise, if you do this mistake in the exam, so it will be difficult for you guys. Do the practice if you don't know, but still go ahead. Okay, so if like say no one is there, so I will be closing that our sessions today, and tomorrow we will be joining again. Okay, doctor, thank you very much. So we will be talking about now tomorrow about day 7. Okay, thank you very much, doctors.